Obesity may be more of a risk factor for Covid-19 than pulmonary lung diseases. There is massive caveats with what I've just said. Most of this research is coming out from mainly the USA, mainly from Louisiana and the New York regions, which may have an impact upon their own obesity epidemic going on there, that may have an impact upon Covid-19 itself. This is kind of backed up from what we've found out from statistical analysis in terms of the UK stats, and UK being one of the most obese areas of Europe. However, these are only preliminary findings. We don't know. They're so new.
To put it into context, if you had an average risk of death coming into hospital, being obese increases the hazard of death by about a third. So it's a big size effect.
This is a major problem with comparing stats from across countries. Sometimes they're only relative to that region. So you have to be careful when comparing stats from one country and another analysis from another country. This research is so new. In other words, we really don't know at this moment in time. It needs to be backed up by scrutiny and meta-analysis from multiple different peoples before it can become scientific fact. The real question is, why is this? Now, with obesity, there is extended risks according that can make you more susceptible to Covid-19, and that being respiratory problems, heart conditions, diabetes. This can all increase your risk. However, it must also be stated that age is the greatest risk to Covid-19 death. When Horwitz and co., the author of this new current meta-analysis yet to be published in New York, took those mediating factors out and utilized supposedly metabolically healthy individuals, they realized that the risk factor was still higher than something like pulmonary lung conditions, which actually surprised them a lot. And in a way, it should not be surprising, because it also puts you at risk for things like influenza. You've got greater risk of dying. What is surprising is that this is the first time that it's been shown statistically in another coronavirus. It is surprising that it's putting them at risk beyond the things that we would normally or would logically expect would put you at risk, something like a lung condition or a heart condition that is not been obesity related. Now, Dr. Oakenshaw, through his own analysis of the environment from a field study case perspective, it's probably caused by a mixture of a large abdomen forcing down upon the lungs, because decreasing lung volume, therefore making it harder to breathe. A large amount of inflammation within the cells of the muscle itself, caused by excess fat. A lack of mobility, making it harder to exercise or harder to move, harder to breathe. Having restricted breathing is known to be a risk factor towards dying from Covid-19, although a very minor risk factor, that's stated. So in other words, get your snoring fixed. So what could potentially mediate these? It must be stated that we don't quite know, and this is a possible logical scientific understanding answer to this potential question. So what could potentially help one with their lung capacity to prevent or decrease the chances of? Well, you could exercise. You could do cardiovascular exercise that increases cardiac volume, traditional long cardio that will help increase lung volume and lung capacity. Now, granted, there is no researched evidence to suggest this. However, it's easy to surmise why this could increase your chances of surviving Covid-19. However, noted, it does not prevent you getting the disease. Far from it, in fact. We know that exercise can help with well-being as well, because it releases pleasure hormones that also help with the exercise process. Generally, losing weight can be good for you in this situation, and I know we're all cooped up in house at the moment, but there is a ways you can find exercise. Even if you have children, you can do an exercise at a time when it benefits you personally. There's no such thing as having no time, especially at the moment, unless, may I state, that you are a key worker and you're working excessive amount of shifts. Likewise, I've got to remember that when giving up standard advice like that, is everyone is individual. and everyone's lifestyle does not necessarily equate to it. So for that, advice may not work for someone else. Individual differences are key here, but more so when it comes with the evidence and advice that may or may not be true. It is clear when it comes to lifestyles, supposedly lifestyle hacks or lifestyle guidance, that these things can only be equated to an individual. Everyone has to adapt it and utilize it to their own needs and perspectives. Likewise, I know that even though this is the evidence that about exercise, not everyone enjoys exercise. Because they are large, they find it harder to move and be mobile. Like I said again, it's harder for them to move their bodies. But at the same time, it could also be a trauma at a young age, not necessarily like in PE. It could be a host of other factors, drawing direct correlation from the causation that you will enjoy yourself more, therefore get a better well-being. Fails to ignore other environmental factors as well, although it can be useful too. However, if you are overweight and unhealthily obese, you can utilize this time to gain healthy habits, learn, and try and move yourself into a healthy weight. Yes, I know some of you have tried, but some of you might need guidance. And that's where getting an online PT may help. Alternatively, if you don't have the money, there's plenty of free resources out there at the moment. And before anyone states, this is not fat shaming. This is not fat shaming. I am simply grabbing the facts as we know them at the moment and extrapolating those facts, or at least stating those facts if I'm not extrapolating it. The reality is we don't know why, and we certainly don't know if this is the case, that obesity is an increased risk of dying from COVID-19. And anyway, that's not my job to state that, and I would have never stated that on this whole entire video. However, for us to bury our head in the sand because of facts and not take note of this potential risk factor would be worrying, if not evil or wrong for us to do so. It will be bad for humanity not to take into account these potential factors and see if they are right or wrong, like we would do with any other medical factor. And likewise, it is easier to remember that these are associations, not necessarily direct causal fact. We're also relying heavily on anecdotal data, and anecdotal data is not enough for scientific information to be classified as factual. It is me observing something, but not in a scientific way, or backed and verified by other people through science. Now, I know a lot of people are going to be sitting there and go, wait a minute, man, this guy's a hypocrite. Because I stated one thing, and then to them, maybe I am almost contradicting myself. Mid-sentence, same through the video. I am not contradicting myself. This is what we call nuanced science. I give you an argument, and I show you the converse argument, reasons why or why this may not be the case, or the reasons why we don't know. And I build up a scientific argument to base that fact on that may or may not be accurately correct, or it could even be disproven for all we know. And that's what I've tried to show. I tried to get you to think and think critically. We can't understand everything unless we know the full fact, unless we know everything about it. The risk factors, why it affects some people more than others, why it may not affect some people more than others. Is exercise a tool in beating this? Is exercise not a tool in beating this? Why this may work for some people, why it might not work for some people. Including context into that argument as well. And I consider that as part of a 4-part model. Nuance and context are part of that in terms of relevancy. Looking at everything blinkered like this could only show you one part of the entire global model of something. You need to be able to piece through it in detail and find its relevance and context. And once you find the context of something, you can in fact help change it relatively to what you know and understand why it doesn't work in some cases. This is where dosage also is rather important. Dosage is very important to understand when or where not to apply something relatively to its context. I.e., let's take, well, this has loads of fat, so therefore it's bad for me, but if I'm in this yet again, it's got extra amount of micronutrients, so therefore it must be good for me. Yes, they can both be good and bad depending on how you look at it and depending on the situation, circumstance, content, relevancy, and other factors. So I hope this has explained a little bit further and explained the situation a little bit further. I might have not done. Whack it down below what you think. I hope this explains a little bit further, and I hope this hasn't come across as a rant or social commentary. Immersive sports science, not about social commentary. Trust me, in sports science, social commentary, not a good look. Is obesity a risk factor? Do you think obesity is a risk factor? Do you think, you know what, it's not, it's comfortable, it's fat shaming, whatever? Whack your opinion down below. This is Immersive Sports Science, not bro science.